One of our favorite topics here on the Breast Podcast ever is fat. How do we use it? How does it play a role in reconstructive surgery? And recently I had the chance to go to a very interesting seminar on a type of fat called Alloclae. And I thought Dr. Saraswat and I would talk about it.
It's a great topic. Like you said, we use fat grafting almost every week, if not almost every day. And it's a very powerful technique to get the fat, get the volume where you want it. And one of the, concerns, questions, comments that comes up is, I would like to have fat grafting. I think I need it, but I don't have enough fat.
Yeah. So that's a great point because Alloclae is a perfect solution to this problem. So what if you have a patient who's quite thin and doesn't really have the fat to do fat grafting, or doesn't want to go back to the operating room? And I think that's another real advantage with Alloclae. It's a type of structural fat. So much like the acellular dermal matrix that we've talked about, which is derived from cadavers, this is fat derived from other people, but it's had its fat cell elements removed, and it becomes like rebar in a building, a structural fat. And in that, we can use the fat either for augmentation or for reconstructive purposes. We can do it in the office. It doesn't have to be done in the operating room. And because it's structural, it's not normal fat, it doesn't go through the same resorption. Mm-hmm. So the fat doesn't die. You don't have the same inflammation. You don't have the same concern with fat necrosis and oil cysts and those types of problems that we can sometimes see with fat grafting. So it really is a very different approach to fat grafting, although in some ways it's similar because we're using it for the same indications, the same reasons, which is improved volume. I think the patients that it would make the most sense in are people who have small areas of deformity. This is true after a deep flap. This is true after a tissue expander or implant reconstruction where you may have some rippling. Certainly true in the en bloc patient where we may have some scar contracture. I think these are all people that we can use the structural fat to improve small areas of deformity. And again, we can do it in the office, so we're avoiding the operating room. So it really is a very different approach to our understanding of fat and how we can use it in the future.
And I think it's a great point, and we can talk about this in the reconstructive realm and in the cosmetic realm. But oftentimes, what I see for reconstructive patients is, those who are very skinny, very petite, very fat deficient to begin with. Those are the patients who really need fat grafting.
Yeah, that's a good point.
When you do implant-based reconstruction or autologous reconstruction, flap reconstruction, you have their very skinny, petite, fat deficient bodies contrasted with an implant or contrasted with a flap. And what we're looking for and what we strive for is a nice transition from their body wall to the flap or their body wall to the implant. And fat grafting typically provides that kind of transition. And the people who need it most oftentimes don't have it as a donor.
And I think for the augmentation patient, for the reconstructive patient, it'll help with cleavage, kind of medial pole fullness. In the en bloc patient, it'll help with lower pole deficiency, particularly if you've had a scar below the areola. So there's a lot of uses here that I think Alloclae will give us. And it is something that is starting to become a bit more mainstream.
One interesting point, like you said, we're not really going from, fat injected to fat salvaged. It's more like product injected to a gain in volume.
Right.
So we've had this conversation time and time again. I'm going to do a fat grafting. We're going to put in, we're going to potentially overfill, and then we're going to lose some fat.
Yeah.
And back in the day, back 10, 15 years ago, we may only keep 50% of what we put in. Nowadays, with Viality, with the newest techniques, we're talking more like 80%,
Sure.
85%, but we're still losing some. And it's really interesting to have a technique, have a product where you'll put in some volume and you may get more out of that than you put in.
Yeah, it is. It's kind of like some of these facial fillers in that it's more structural than it is tissue. And what I mean by that is you don't have the same response. The body doesn't see it as much as something that needs to be metabolized and broken down, which is where that fat loss comes from. When we talk about losing fat, it's because your body is responding to it. And here the response is less because it's something that's been treated before injection. And so I think it really does provide the ability to get more out of the same volume that you add.
Yeah. And I think, patients are excited to hear about it. When we talk about fat grafting and I'm asked about recovery and how things are going to feel, usually the fat grafted areas do fine. But, what I tell patients is liposuction hurts. You're going to be swollen, bruised, battered for a little while, and then you're going to feel great. But not having that liposuction portion of the fat transfer and the fat graft is really exciting.
Yeah, some people love liposuction, and it can really make a big difference. But some people are really very intimidated by having that liposuction procedure, and the Alloclae obviously avoids that piece because we're not harvesting it from the patient. It's already something that's been harvested. I do think that it's being used right now quite a bit in the breast area. People use it for hip dips, kind of at the pelvis. So those are the areas where I see it the most right now. But time will tell how we're going to use it in a broader context. Now, the volumes are more limited. It's not like we can get very large volumes of the product. So it really is more for defined areas that need to be improved, augmented, filled out. And I think that as we get more experience with it, we'll find wider and wider uses for it. I think this is going to be a real game changer when it comes to the fat grafting space.